Good morning everyone and welcome to this meeting of the Audit and Performance Committee of the Perth and Kinross Integration Joint Board. We're meeting today to discuss the annual performance report and we've got a meeting solely focused on that, as we have had in previous years, so that members can give that due consideration before it is then submitted to the Scottish Government. So before we begin, I'll ask the clerk if there are any apologies and any substitutes for this meeting.
Yes, thanks, Chair. Good morning, everyone. We have apologies today from Pat Kilpatrick, and we have Bob Benson substituting. We also have apologies from Ronnie Erskine, and we have Donald McPherson substituting. I think all other members are present. Okay,
thank you very much. And welcome to Mr. Benson and Mr. McPherson. You're very welcome. I think we also have the chair of the IJB here as well, in attendance today. So welcome to Councillor Drysdale also. Now, can I ask if there are any declarations of interest in line with any of the business on the agenda today? If members could please indicate. I'll take silence to mean that there aren't any declarations of interest, so then we can move on to the item that we are here to discuss, which is the annual performance report, and I'll ask the Chief Officer initially to begin introducing this report.
Cheers, thank you very much. Good morning, everybody. I'm very pleased to be in a position to present to the Audit and Performance Committee of Perth and Kinross Integration Joint Board the Health and Social Care Partnership's annual performance report, which covers the period, the financial year 2021. Clearly, this reflects a period impacted on significantly by the COVID pandemic, an unprecedented time which brought enormous challenges, during which it was necessary to adapt our approach and to prioritise our activity to seek to mitigate the impact the pandemic had on our services and staff, our citizens and communities. This unprecedented period means that we have an annual performance report that reflects our performance during that period, which limits to some extent our ability to compare our performance with previous years, but does allow for some of the data to be compared with the Scottish average figures, which will hopefully prove useful. The information presented in this annual performance report really reflects a composite of the now regular performance report that we bring to the Audit and Performance Committee. This reflects the fact that the previous joint inspection of the Health and Social Care Partnership recognised that there was a dearth of performance information, and I think we made significant progress in delivering on that as an action point by presenting to the Audit and Performance Committee quarterly performance reports, which are built up to enable us to provide for you today the annual performance report of the Health and Social Care Partnership. This report includes data on performance relating to the Health and Care Experience Survey that's carried out, and that's featured on page 7 of this report. The KPIs, which reflect, the key performance indicators, which reflect the national outcome measures and the targets set by the Ministerial Strategic Group. And we've also incorporated our Pulse Survey findings at page 13 and Mental Health Pulse Survey at page 14 to reflect some of the feedback that we've garnered from staff in the context of their activity over the past year. In the body of the report, we've provided narrative on specific areas of service delivery. These seek to reflect our activity and how we have adapted various services in response to the pandemic. These very much align with the actions that we've included in our remobilisation plan, which members of the Audit and Performance Committee will recall has effectively become our annual operating plan for this year. And you may also recall that we've assessed the remobilisation plan in the context of our strategic commissioning plan and have identified clear alignment between the activities in the remobilisation plan and the delivery of the IJB's strategic priorities. However, the challenge in providing services during the global pandemic has impacted on the challenges also of providing an annual performance report to reflect our activity during that time. Our priorities have obviously been on effective service delivery, and that might mean that some actions that we would have wished to have advanced in the context of our annual performance report need to be developed further. For example, we do recognise the limited extent to which we've incorporated patient and service user feedback into this version of the annual performance report, and we would seek to be addressing that moving forward. I think from my own perspective, it would be very useful if we could, recognising that we had a very low baseline when we started to deliver on annual performance reporting, it would be useful now that we've incorporated that activity to develop it further and to be thinking moving forward about how can we perhaps provide case studies that demonstrate the human impact, the effectiveness and the outcomes that we're delivering. And that's something that I would like to see in our future quarterly reports to the Audit Performance Committee, to actually show the difference that we're making in perhaps some of these case studies. I think the other thing to recognise is that this annual performance report does not at this juncture include information on the performance of services that are hosted on our behalf by the Angus and Dundee Health and Social Care Partnerships. That's something that we've recognised previously that we would want to address. We haven't managed to do that, but we will look to share with members of the Audit Performance Committee and the wider IJB the annual performance reports of those two other health and social care partnerships in due course. Finally, Chair, just to acknowledge that against a very challenging backdrop, as I've said in the foreword of my report, it is really important that we recognise the significant contribution and commitment of staff within the Health and Social Care Partnership and across our partner agencies in terms of their versatility, professionalism and the compassion that they've delivered throughout what has been a year like no other. And just to summarise, the performance data that is included in this report builds really effectively on previous year's APRs, where we've been able to demonstrate that notwithstanding some of the challenges that we've been experiencing, really effective performance around or above the Scottish average, continuing to deliver effective services to demonstrate that performance. And hopefully members of the Audit and Performance Committee will be assured that the data that we have within this report reflects continued good performance on the part of the Health and Social Care Partnership. We have no complacency about that, and we are continually looking at how we can build on it. What we're now looking at is how we can build back better on the basis of some of the accomplishments that we've achieved over the year that this report covers in terms of our COVID response, the versatility of our staff, our use of digital technology, our closer working with partner organisations, the resilience and voluntarism that communities have shown, and our work with the third sector to ensure that we can enshrine and embed early intervention and preventative services. Chair, I commend this report to you. I hope that members will feel that it's a positive and helpful reflection of the work of the Health and Social Care Partnership. I'll stop there because I know that there will be a lot of questions either about what I've just said or the detail of the report. So thank you very much for that.
Okay, thank you very much, Chief Officer. Now, I'll start by inviting questions either on what the Chief Officer has said in his introduction or on the report, and then we'll take comments after that. So first I have Mr. Benson, if I could have your question please, and then I'll come back to you a little later for your comment, if that's okay. Thank you.
Thank you very much indeed, Chair. I suppose one of the main issues that Gordon has highlighted in his cover paper and in his foreword has been about the way in which things will be delivered differently and building back better. I suppose my question is that how has shifting the balance of care been progressed? I think this is a very positive report, but I think that's one area that I think we would like to see more highlighted within the report. How is that being, how is that type of performance being highlighted and measured? And the other one, I think, is an overall issue is about different data sets depending on different ways of collecting and reporting information. This appears throughout the document. But there's perhaps a bigger question, but if we start off with building, shifting the balance of care, and what would that mean for future financial plans? Thank you.
Chief Officer.
Thank you, Bob. I'm happy to take that question, but I would also wish to highlight that the report is obviously the product of a number of colleagues' effective work, and a number of those are also on the call. They may well, in the meeting, and may well wish to contribute. So I look forward to some of my colleagues putting their hands up in response to some of the questions or comments as necessary. So in terms of shifting the balance of care, I mean, I think the period covered by this annual performance report and the COVID pandemic period has given impetus to us to look at how we can develop different approaches and adapt services in a way that seeks to shift the balance of care. And by that, I mean about preventing admission, about supporting people more effectively in their local communities, about reducing the need for people to go into hospital, and certainly reducing their length of stay wherever possible by supporting early discharge. We have been very effective in the context of our pandemic response in reducing the numbers of people whose discharge is delayed. And we've put in place a number of mechanisms that enable people to be supported back in their own homes more effectively and more sustainably. We've invested heavily in our local integrated care service. We've invested in our integrated discharge hub. We've provided support to the third sector to enable them to provide services that advance our ambition for early intervention and prevention. And we have made really good effect of the opportunities that have been provided by the Scottish Government's remobilisation funding in order to try to ensure that we are taking considerable pressure off the hospital system, particularly at that point when we were planning for the very worst that the pandemic might bring, hoping for the best, and anticipating that the demand on hospital services was going to be excessive. So we've done a lot of work in this area. I am under no illusions that our challenges are around how we sustain and build on the effectiveness of our response to date. I think there are other areas that we need to attend to that are well recognised nationally, including by the Scottish Government, in relation to the large hospital set aside and how we can potentially release any funding that might currently be being committed to acute hospital services in order to focus more of our activity more effectively on keeping people well, keeping people at home, keeping people out of hospital, and taking a much more public health, proactive health promotion approach, which, as you'll know, Mr. Benson, is something that I have elsewhere expressed a strong commitment to, and I think becomes part of our transformation plan moving forward, and indeed potentially also can be addressed through some of the consideration that we're giving to how we might restructure the health and social care partnership to invest more heavily in that type of approach. So there's a number of aspects there that I think we are addressing. There are a number of other aspects that we need to look to for national steer and to engage with our colleagues in statutory organisations to think about how we can more effectively embed that approach so that the balance of care is shifted as you've described. Thank you very much.
I'll come back later on some of that. Thank you, Chair.
Thank you, Chair. Thank you, Mr. Benson, and thank you, Chief Officer. Sorry, I've got the situation again where people's chats are obscuring my buttons and my ability to unmute myself. So I'm now I'll just leave it unmuted. Right, next we had Councillor Duff, who had a question. Councillor Duff.
Thanks, Councillor Powers. Yeah, thanks for the report. Lots of good information, good explanation within it. If I could make just an observation, it's handy to have the Scotland figures to compare our results, but there's no indication of whether the Scotland figures are up or down on their previous figure, which might be helpful. Just an observation in that part. In relation to my question, table 4 on page 15. And the indicator 16 and possibly also 19, but number 16 talks about the rate per 1,000 population of falls that occur in the population aged 65 plus who are admitted as an emergency to hospital. Is that the rate per 1,000 population of over 65s only, or just the entire population? Because obviously with having a higher older population, then obviously your figure's going to be higher, and I don't know if it bears comparison unless it's you know, specific to the age group, but I hope that kind of makes sense.
Yes, absolutely, it makes sense, Councillor Duff, thank you. I suppose, to paraphrase, if we've got a larger elderly population and the figures only reflect that population, we might see them reflecting a particular performance, whereas if it was the whole population, that might be slightly different. I'm afraid I don't to hand have an answer to the question around the detail behind that performance indicator as such. It may be the case if Chris Jolly has joined us, been able to join us, although I know he was having some difficulty. Oh, I see that Chris is going to make a comment, which I'm grateful for, Chris, if you would, please.
Yes, thanks. I've got a little bit reduced functionality for reasons I don't quite understand, but grateful to have been able to join the call. Thanks, Councillor Duff, for your question. You're completely right. There is a rate per 1,000 population of the over 65 age group. The normalisation that's done here does, however, reduce or normalises the rate across different populations, so that the core number of people who we have over 65 in itself isn't going to push the number up because it's a rate, but nonetheless what it's designed to do is to allow us to understand how many falls there are in our population relative to that of elsewhere.
Yeah, no, that's fine. I think it does have a direct comparison then with elsewhere. Yeah. If it's only over 65s, for instance, that we're measuring in this instance. Okay, thank you very much.
Thank you for that, Councillor Duff. Apologies, my internet just dropped out there, so we're not having a particularly good day technology-wise here. I'll move on to Mr. McPherson. You had a question.
Yep, thank you, Chair. And just firstly to say, I mean, I found this coming to P&K from a relatively low level of knowledge. I found this a really useful report in getting to grips with some of the issues and themes that you've had to face. So, you know, well done to all of those who've had a hand in writing. There were 3 areas where I felt it begged a question. So if I can maybe just pick up on these. The first one, it's on page 14 in table 3, where if you look at NI 8, that really just about 1/3 of carers feel supported by us in the role, which always strikes me as a very low number and feels like we should be doing more about it. I know it's not a specific Perth and Kinross issue. Dundee has a very similar number, and I just wonder why why we seem prepared to accept that much lower level than in other areas. On page 15 in table 4, there's no narrative at all around NI 20, which is the emergency admissions KPI. So I wasn't really able to work out what that was telling us. And finally, on page 20 in the staff pulse survey, there's a number of the measures which are between 50 and 60%, which again seems quite a low level of staff feeling satisfied in the role. So again, you know, what is being done, if anything, what can be done to drive these up? So these were 3 areas, as I say, that came out at me from my reading of the report. Okay, thank you, Mr. McPherson. So perhaps, Chief Officer, if you want to take the first and the third one on carers and on staff and the lack of support for them, their perception, and then Mr. Jolly perhaps can talk about the lack of narrative on NI 20.
Yes, thanks, Chair. That's helpful. I would be grateful for Chris's clarification in relation to that particular indicator. Donald, thank you for your questions. I think absolutely valid, and I think, you know, more generally, there probably has to be a bit of challenge that we apply ourselves as officers to this report, as we do elsewhere, and that is that so what question. So either, so what does that tell us about our services, what does that tell us about people's experience, or what does that tell us we need to be thinking about doing to improve performance, and sometimes improve performance regardless of what the Scottish average is telling us, because we would always be wishing to strive to improve and to better our previous year's results. I do agree with you that the carers feeling supported is not a figure that we should at all be content with or complacent about, even although we are, as I've said, outperforming Scotland. It's more important that we see a figure that satisfies ourselves and satisfies carers and satisfies the IJB, that all we're doing is adding value and supporting carers to continue in their caring role to the extent that they wish to be able to do so. Kenny Ogilvie may have a contribution to make here, but before that, I would say that we have developed in Perth and Kinross, I think, a very effective and responsive carer strategy, and it's probably for others, including others on the IJB in terms of carers representatives, to advise whether they feel that's the case. But I certainly feel it's something that we can be rightly proud of in terms of engaging and designing and co-producing a local strategy that seeks to provide support to unpaid carers and that recognises the toll of caring and recognises the value of their contribution. That said, during the course of the pandemic, we also did carry out a local survey in relation to how carers were feeling supported, whether they were able to continue in their caring role, whether they'd had to take on more caring responsibilities, whether that had been willingly or because of services being reduced. And again, that was something that informed our development activity and action planning. And indeed, my recollection is it reflected fairly positively, very positively in some regards, of the support that the Health and Social Care Partnership extend to unpaid carers across Perth and Kinross. But absolutely, that's an area that we need to look to improve, because notwithstanding what I've said, it is a figure that is quite stark, and one would want to get to a position where many more carers felt supported in their caring role and had a good balance between what the caring demands were making on them and the other aspects of their life and the life choices and opportunities that they should be able to avail themselves of. I suppose similarly in terms of the staff survey, it's again the case that we shouldn't be at all complacent that we may be performing better than Scotland. We need to perform better than we did last year, and we need to perform better full stop in terms of the ways in which we engage and support and value and communicate with our staff. We do have a range of measures that we've identified through our remobilisation plan that are being advanced to improve in these areas, particularly recognising the significant physical, emotional and psychological toll that the pandemic has taken on our staff. And that is about both what support we can be provided with and avail ourselves of from Perth and Kinross Council and from NHS Tayside as the employing organisations, and what additional support we can provide as a health and social care partnership. It is probably the case that we have had to work doubly hard to ensure that we are engaging and visible because of the virtual world that many of us are having to operate in. And that in itself presents a challenge, as we know, to make that sort of informal connection with staff, to get a sense of how staff are, how they're feeling, are they supported, are they connected. So there's more that we are doing there, and there's more that we would strive to do in order that we can address your legitimate concerns that and the earlier figure that you referenced should not be something that we should necessarily be overly content with, and we should be seeking to address. I see Kenny's able to provide a little more comment and context in relation to carers feeling supported, so I'll bring Kenny Ogilvie in at this point. Thank you very much.
Just basically to echo Gordon's comments, obviously the past year has been extremely challenging for everybody, and people have felt isolated in their professional and their private lives. So again, it's been particularly challenging for a lot of unpaid carers who were potentially feeling isolated even before the pandemic. We have done our best to respond to situations as the pandemic has progressed. I mean, for example, respite in care homes has been available throughout the pandemic, but just with the various restrictions around care home admission, if people were going into a care home, they had to be tested. They often had to isolate for 2 weeks when they were in. So that obviously put a lot of people off using that, which then provided extra strain on carers, who again, maybe their traditional or their normal social networks may be restricted as well because of the pandemic. Like I said, we have done our best to respond as much as possible to that. For instance, offering outreach support, etc. Carers going into people's homes, providing extra sitter service support so people can at least leave the house and get out and about. Daycare was obviously stopped for a period during the pandemic as well. So it's just been a case of trying to respond to the situation, trying to provide support quite often in people's own homes to allow carers to get out and try and get a break from their caring role. But yeah, like I say, as Gordon says, that figure is far too low in terms of carers feeling supported. And yes, we'll continue to work with our various colleagues and partners through the Carer Strategy Group to try and improve on that.
Thank you, Mr. Ogilvie. Mr. Jolly, on the second point about the indicator lacking narrative.
Yeah, thanks very much. I can only apologise for the narrative not being included. That's just been a mission in this particular submitted version of the report, and we will include narrative after the committee and before the report is finalised through the design stage. I can comment, however, that the particular indicator NI20 is designed to provide an overall indication of the balance of care. It should be noted that not all emergencies can be avoided, and people will ultimately still be admitted to hospital in an emergency situation. The population of Perth and Kinross being as it is older and getting older, and our larger population getting larger, will have an impact on that. As people age, their propensity to require emergency admission will go up. The overall indicator, however, is there to provide a measure of how well we are indeed moving resources from that emergency response to non-emergency responses, early prevention, intervention. I don't think there's a lot more for me to say just at this time, but I'll certainly provide more narrative after the committee.
Okay, thank you, Mr. Jolly. Right, I've now got a question from Bernie Campbell.
Hi, thank you very much. My question actually is in relation to the data and the information provided, which is showing us the percentages in 1920 years. So we actually have got nothing that's for 2021. And I'm looking at table 3, which was referring to, I think it's on page 25, and the information in that also, I'm assuming, refers to 1920. So I wonder the benefit of that. You know, it's difficult to ascertain where we actually are today if the information that's provided is over a year out of date, unless I've misunderstood. I would just add to that in relation to Gordon's comments and actually Kenny's with regard to carers. I have to say and can confirm that certainly in this last year there has been a lot of support provided for unpaid carers, and I know through our carers voice group, and we have been invited to take part in the strategic planning group, and certainly engaging more in local groups to support carers. My final question would be in relation to the fact that we talk about sustainability, and we know that there is a huge dilemma at the moment, certainly within Perth and Kinross and possibly across the country, in relation to recruitment and retention, and thinking of staff. So thinking about going forward and supporting, you know, care at home, which in effect supports unpaid carers, that are we likely to be able to provide the care that would be required going forward, taking into consideration the recruitment challenges at the moment? Thank you.
Okay, thank you for that. If we perhaps start with Mr. Jolly on the data points, and then if the Chief Officer could come back on the question of sustainability of staff.
Thanks very much. Yes, the table 3 relating to NI 01 to NI 9, that is older data and comes from the Health and Care Experience Survey, which is a Scotland-wide survey which is run every 2 years. So the data that's in that table under ordinary circumstances would have been published within our annual performance report of last year, but that wasn't possible because the publication wasn't made by Public Health Scotland until much later in the calendar year, hence it's coming forward this year. The Health and Care Experience Survey will, however, be run, as I understand it, again this year, and so when it comes to next year's annual performance report, we will again have our HACE results in. That would be done in the unusual position of having HACE results into 2 consecutive annual performance reports, but that is a COVID-related reason due to the late publication. In respect to table 4, I note the header is now how we compared to 1920, and that I think is an error in the description there. If we look at the data, in fact, sorry, I'm just rereading it myself. No, it's a comparison from the previous year. So we can see the performance in the second column of table 4 is the information for year 2020-21, and the column header is how we compare to the year prior to that. So the information is up to date. If the third column, fifth column tells you the date to which the the data is recorded up to. Committee members will note that some of them are to the end of the calendar year 2020 and some are to March 2021. And that is purely on the basis of the national publication of data. And so the committee can be assured that the information that's contained within the report is the most up-to-date information available for the partnership's performance over the 2021 year.
Okay, thank you, Mr. Jolly. Ms. Campbell, does that answer your questions?
Yes, it does, but I was actually referring to table 3, which actually says that 2021 Perth and Kinross information is not available. So
that's absolutely correct.
I was linking that to the care at home, which is on page 25. The information that's there, those figures reflect 1920 and not 2021. Am I right? And it was just to say that, you know, it's difficult then to know exactly where we are. But I appreciate the challenges we faced in the last year. But
apologies, Chair.
No, on you go.
Yes, so table 3, you're absolutely right. That information is old information, and it should have been published last summer as part of our normal annual performance report. But it is a survey that's held nationally, is only published every 2 years, so we're not in a position to publish it any earlier than we have done today.
Thank you.
Okay, and the last question was on the sustainability of staffing for care at home and the impact on unpaid carers. Chief Officer, if you wanted to take that, please.
Yeah, so I suppose at the strategic and high level, I would just remind the members of the Audit Performance Committee that we are continuing to work on a workforce plan that will look at how we might mitigate the risks that we're experiencing across a number of services in relation to recruitment and retention. However, we do have particular approaches that we're developing in relation to care at home, including something that we've described as a care at home resilience project. I'd probably like Kenny Ogilvie to give a little bit more information on the measures and steps that we're taking in that regard. So Kenny, over to you again, please. Thanks.
Okay. Yeah, I mean, recruitment and, as importantly, retention in care at home and heart has been a fairly long-standing issue. As Gordon says, we have got a plan or proposals in place to try and increase recruitment and, as I say, retention. One thing we have done in the past few months is we've introduced senior carer posts. A number of senior carer posts for the independent sector. That's to try and give people, you know, a bit more of a career structure. So that you come in as a carer, you can see a potential career structure to encourage you to actually remain in that profession. We've also secured funding, and hopefully we'll be recruiting to in the very near future a graduate trainee post, and that's to focus on raising digital awareness of care at home. Maximising use of Facebook, Instagram, etc., and just, you know, get the message out there, not just on the vacancies that are available, but also you know, care at home being a rewarding career. We're also endeavouring, certainly with our heart posts, to make sure that any vacancies are advertised as permanent posts rather than fixed term. When we advertise permanently, we usually get a reasonable response and we are able to recruit to most of the vacancies, but fixed term posts we found certainly in recent months extremely challenging to recruit to. And also we're working closely with our HR colleagues who are tapped into the wider employability network in Perth and Kinross. And certainly companies, or the larger companies that we're aware of, that are unfortunately having to lay people off and make people redundant. We're in touch with them and making sure we're engaging with that workforce as well to make sure they're aware of the vacancies and the opportunities that exist within the care at home sector, including the heart service. And, you know, we do have long-standing ties with the likes of the University of Highlands and Islands, Dundee University, etc. So we're continuing to tap into the the local educational establishments as well to make sure that people graduating or coming towards the end of their course, especially health and social care related courses, are again aware of any opportunities that exist in this area.
Thank you for that, Mr. Ogilvie. Next we have Councillor Drysdale.
Thank you, Chair. I'm having similar difficulties with technology that you are, but that's nothing new for me, I'm afraid. Yes, I wanted to just speak and ask about the section on complex care on page 23 of the report. I'm encouraged to some degree, at least, by the plans that are in place for increasing the facilities available and the support available in the community for individuals who clearly have the most need for support in order to be able to live within communities. Obviously, the report speaks about unavoidable delays due to the pandemic, and that's completely understandable, and also the impact on things like day centres and daytime support during the last 18 months. And clearly there must be concern about individuals who do require that support, but for the reasons of the pandemic have not been able to receive the level of support that we would like to give them. As an elected member myself, I do have from time to time cases that are put to me that express worry and concern about support that these individuals are able to receive. And I just wondered if, I don't know who it would be, whether it's Gordon or whether it's Kenny, that would be able to give a bit more detail on the extent of the support that, we're talking here about core and cluster developments, individual houses for clients grouped together with separate staff accommodation, which sounds to me absolutely ideal. And I just wondered if an indication could be given of the number of such properties that we have available and we plan to have available in the foreseeable future.
Thank you, Councillor Drysdale. Who would like to take that?
I start, Kenny, if that's okay. So thanks, Chair. Thanks, Councillor Drysdale. I mean, I think there's probably a need for us to draw a bit of a distinction between what are the operational contingencies that we have put in place and what adaptations have we made to existing service provision in the context of the COVID pandemic, some of which have been a requirement of Scottish Government guidance in relation to the safe operation of some of those types of registered services, and draw a distinction between that and the more strategic complex care programme of activity that we have embarked upon, which includes some major developments to put in place accommodation and support and technology enabled care to support people who are either young adults with disabilities coming through transition, people who have been in long stay hospital and are needing to be supported by specialist resources locally, and some other people who are placed out of area who we would wish to repatriate. Now, I'm conscious that we have been looking to give the IJB an update on that complex care transformation programme, which is, 3-5 years work moving forward. And I see in my inbox on my return from leave today that I've got a draft report in that regard from Kenny, who leads on that programme. So separately, we will be providing a bit of detail to IJB members on that transformation programme, which is around, the strategic direction, the funding that's necessary, the initiatives that are being advanced, and if we need to incorporate something in a bit more detail about bed numbers and locations, we can look to do that. So we'll provide that information separately. Kenny, though, in relation to the points, sorry if I've stolen your thunder, and those were the answers that you were going to give. You might want to say a wee bit more, though, because you're far more immersed in this area of work and taking that leadership role. So I'll hand over to you in that regard.
Thanks, Gordon. I can certainly give more details in terms of the numbers. We've got 9 proposed developments across Perth and Kinross, which will give a total of 46 units of accommodation and for clients, and 7 staff units. As is in the report, unfortunately, building work was delayed during the pandemic. We had hoped the first developments would have been on stream this summer. That's now been put back, but we are hopeful that the first one will be available by the end of this calendar year. So December is down as the start date for the first development, with the majority of the rest being on stream the following year, and then another couple the year after. Like I say, it's not just about the actual buildings. There has to be suitable models of care there as well, but the tendering process is designed to fit in. So once we get confirmation dates of the start dates, we can work back and make sure we've got the care arranged that's in place for the timing of the buildings actually being available. Just in relation to daycare, just to confirm that building-based day care is available again. Numbers, unfortunately, are restricted at the moment due to social distancing and following Scottish Government guidelines. But again, places have been prioritised dependent on need. But we are hopeful that those numbers will increase in the coming weeks as restrictions ease further.
Thanks, Kenny, and thanks, Gordon. If I may just come back, Chair, to say I'm delighted to learn of the numbers of properties planned and the support that's to be provided. You know, from my own perspective, I would dearly love us to be able to treat that with the high priority it deserves amongst all the high priorities that we do have, but that is a particularly high one for me.
Okay, thank you very much. Now we have a few further questions from members coming in. So I'll go first to Mr. Benson. You had another question.
Thanks very much indeed, Chair. And it's really interesting, the narrative around the questions so far might make us have to think later on about the approval part of this document, because I think there's been a lot of helpful interventions. I think one of the things I just want to pick up quickly is on page 11. It refers to the strategic planning group being reinstated at the end of 2021. Although the group itself didn't meet until the next reporting period, we might wish to tweak that statement within the document as a result of that, because clearly the SPG did not impact on the outcomes for 2020-21. So I'll leave that one with you. I think one of the other things I picked up earlier on was around data, and it says in a number of places that there are different recording practices in Scotland, and I think it may have been connected to John Duff's question around about Falls and 16 NI 16, and about NHS Tayside has different recording practices, or Tayside has different recording practices, I should say, from other parts of Scotland. And I wondered where it was helpful if we might pick up on where Tayside is recording helpful information, so we could at least make a comparator with that, where it may be more useful rather than reporting against Scotland. And that's just a suggestion. I completely concur with Donald's point about the staff pulse survey and the issue about 56% of staff saying I would recommend organisation a good place to work. Clearly, this is an issue that I think really needs to be looked at very carefully. But my substantive point is about health inequalities, which is covered within the cover paper and in the forward, as I recall. So I think one of the things for me is about, if we want to address this in terms of performance, we need to identify where these health inequalities actually exist, in which specific population and for which outcomes. And I think we need to measure this, and then we need to have systems for recording information, systems for analysing and reporting that data, and then means of feeding back that information along with set targets for improving outcomes. If we are to identify this area much more carefully moving ahead, and that will have an impact for us when we eventually in this year start to work towards hopefully a public health strategic plan as well, which would help with that. But I think there's something we need to say about health inequalities. What have we been able to do about that? Because we have clearly identified it, and there's clearly a Scottish expectation, Scottish Government expectation that we do. So I would very much like to see something a bit more fulsome about that area, even if we're not able to do it justice as we would prefer in the reporting year.
Thank you, Mr. Benson. I know there are probably more comments than questions, but I don't know if the Chief Officer wanted to make any points in response to what was said.
Yes, Chair, I'm happy to. Thank you, Bob. I think health inequalities is one I'll focus on first of all. We do have within our budget this year some provision that was agreed last year around developing some work around something called the Integrated Resource Framework. This is an approach that was previously advanced fairly effectively in Perth and Kinross, and it looks at the levels of health and social care service consumption in different areas of deprivation across the region and across different demographic groups. So that provides, that will provide, as we develop that work, a rich body of data that will enable us to look at where there is consumption or underconsumption or overconsumption in relation to services, and then target our response accordingly. Excuse me. In addition to which, I've now got a proposal that's been brought forward by our Associate Medical Director in relation to advancing a health promotion approach, which we're linking closely to the work that Zoe Robertson's been leading in relation to strengthening our work in local communities. And this is about looking at the main health conditions and how they impact on various populations in Perth and Kinross, and seeking to use that data to again deliver service responses and service offerings in regard to either those conditions or those communities. And this will link very closely to issues around health literacy. It will link very closely to the NHS Tayside's Public Health Department in anticipation that a greater amount of their focus will be able to be given to non-COVID activity moving forward. So that's a proposal that Hamish Dougal is developing, which has been considered at our EMT, and I'm also looking at how that might feature in the future structure of the Health and Social Care Partnership moving forward, in terms of addressing, as I've said earlier, giving greater priority to addressing issues to do with health promotion, keeping people well and connected, early intervention and prevention. So we're going to work that through and see where that takes us. I know that Hamish has had, or was planning to have some discussion with the Director of Public Health in regard to that health promotion approach. It may well be that we could be looking towards some dedicated resource being made available to support an initiative or a test of change even in Perth and Kinross, potentially through thinking about delegating some of that function, although we'd obviously have to have a great deal of discussion about the opportunities and challenges that might present, but it's an idea worthy of consideration. The other thing to say was...
Chair, may I intervene there? In terms of reporting for 2021, is there any part of that narrative, Gordon, can be included within this report as opposed to being a proposal? I mean, I think the proposal is very worthy, and I certainly look forward to that. But can we at least indicate within the reporting period that this work has been focused on in particular, and that this proposal or proposals may happen? It's just a question. You don't have to answer it just now, but I'm just simply saying that I think that would be very helpful. Sorry, Chair.
Thank you.
No, it's a useful comment. I mean, we might certainly be able to talk about the integrated resource framework because that was part of our budgeting provision. I suppose maybe not. Part of the challenge is we're now in August 21 talking about a retrospective, and that pertains to a period when we probably didn't have these ideas and plans and initiatives coming forward. These are much more recent, but there may be a way of making some links. What I was going to say though is that, you know, we will present and work through the opportunities that I've identified, but what we might also have to be doing is seeking to bring to the IJB a need to reconcile a gulf between our ambition and the affordability of that ambition in the current budget. So we might have to make some difficult decisions about that which we would like to do and that which we can afford to do. Although, as always, the Health and Social Care Partnership officers will look to see from where can we disinvest and how can we make best use of slippage or any reserves, potentially to pump prime something as a test of change for this year moving forward. So health inequalities, health promotion, strengthening communities, early intervention and prevention, making links to public health colleagues, but increasingly building links with community planning partners will certainly be areas that we'll be looking to advance and prioritise in the next couple of years as we move forward.
Thank you, Chief Officer. I think Mr. Jolly also had a response in relation to the different recording practices.
Yeah, thanks, Chair. It was just on the specific point that Mr. Benson raised in respect to the varying recording practices. I think he made reference to falls. It was just a point of clarity that the different recording practices that were referenced in the document relate to NI 14, which is in relation to emergency readmissions. That's been the subject of some previous discussion at Audit and Performance, and we, at the most recent committee, I think, circulated a briefing paper that had investigated that issue. Okay,
thank you for that clarification. If the committee will indulge me, perhaps before I move to Councillor Duff, I've got a couple of questions of my own, if that is okay. The first one is in relation to some of the comments that were made by the Chief Officer at the start when he was introducing the paper about the need to include more case studies and give more of a flavour of how some of our services are being delivered on the ground. And I know that this is something that was referred to last year at the Audit and Performance Committee when we confirmed the annual performance report, and I appreciate, given the circumstances this year, that it's been more difficult to draw that information together. But I'm just wondering, Mr. Jolly, we had a discussion at pre-agenda meeting where you highlighted that some work is being undertaken to perhaps make that process easier in future years, and I think that might be useful just to air that in public session here.
Yeah, certainly. Thanks very much, Chair. Councillor Provis, you're right that it has been particularly challenging this year to harvest the type of information that we would like to see in the report, and you're right that this was commented on last year, and we absolutely would have made attempts to do so to a greater extent than has been possible if it were not for the pressures of the pandemic. In reference to the specific point that we discussed, we are in the midst of an emerging pilot where we are seeking to put in a systematic approach across a relatively small number of services to gain the type of patient and service user feedback that would be most beneficial. In itself, the ethos behind this is to try and understand from services and from the patients and service users that are engaged with those services the extent to which they are being supported, and particularly to get to a point whereby we are able to quantify the qualitative information that is then harvested. It's always very helpful to receive individual comments and anecdotes, and as welcome as they are, a more systemic approach to understanding the impact that we're making at a strategic level is perhaps of more value than in respect to individual comments, and that is not in any way to seek to devalue the comments of individual service users and patients, but from merely a comment in respect to the delivery of strategy. I'd be more than happy to take any further comments on that, but I think we'll be looking forward to reporting out internally to the executive management team initially, and then to committee following the development of that approach.
Thank you for that, Mr. Jolly. I think the Chief Officer also wanted to make a comment in relation to this.
Yes, thank you very much, Chair. I suppose I just want to acknowledge that's a very reasonable challenge, and something that I suppose I have a degree of frustration about, but also a degree of responsibility for, because what we haven't got in this report is, or haven't got a system for gathering and reporting the very regular, very frequent positive feedback we get from people who are touched by our services. You know, I am very often writing back to individual members of staff to thank them for their contribution after a member of the public or their carer has written to me as the Chief Officer saying what a difference it made, how responsive, how helpful, how compassionate and how person-centred our care's been. Now, what we need to do is find a way of gathering that. We're all too often on the back foot in terms of defending or responding to deficit situations. And we do absolutely take seriously complaints, because complaints provide an opportunity for us to learn, to develop and to improve our services or people's understanding of what it is we do. But we do get compliments and we do get positive feedback, so we need to reflect on that. And in the same way as I made that comment earlier about case studies to show the human impact of our services, I suppose more generally I would like to see our annual performance report begin to move to a position where we are less reporting on outputs as measures of productivity and activity, and more reporting on outcomes as measures of effectiveness, impact, making a difference to people's lives. And some of those compliments, comments, positive feedback that we receive but we don't systematically report could usefully provide that in future reports. And that needn't wait for the next annual performance report, Chair. We can think about how we can bring that forward to the routine reports to the Audit and Performance Committee. Thank you.
Thank you, Chief Officer. That would be very welcome. My second question is on something that's been in the news again, hit the headlines towards the end of last week, following on from the publication of this report, which is, of course, the drug-related deaths in Scotland. I think we saw a 34% increase here in Perth and Kinross, which is obviously a matter of great concern to all of us. In the section on alcohol and substance misuse, it does detail some of the things that we are doing to try and address this problem, but there aren't really any measures of outcome, of success, of deaths averted or sadly not averted. So I suppose my question is in two parts. First, how can we measure the impact of some of the interventions that we have been making in this area, and can they be included in the report, because I think that's really important. And also secondly, I know it was towards the end of this last year which the annual performance report recovers, but there was an announcement about funding for drug rehabilitation beds, which have obviously reduced in number over the past several years. I'm just wondering whether any progress has been made in relation to that, but appreciating that did come quite near the end of the period that this report covers. So if perhaps someone could answer those 2 points.
Thanks, Chair. Yeah, absolutely. I'll bring in Kenny Ogilvie again in a second, but I absolutely take on board your point about how can we demonstrate what difference we're making in relation to the tragedy it is, the number of drug-related deaths in Perth, Kinross and Tayside and in Scotland. We need to redouble our efforts here. We need to look at what it is that we're doing, what difference that's making, and again look at, you know, what can we report in relation to positive interventions as well as responding to adverse events and the publications that we're seeing in relation to drug-related deaths nationally. We need to also look at what we can benefit from on a pan-Tayside basis, because a lot of the work that will be being advanced across NHS Tayside will be done initially in cohort with Dundee City Council, and there'll be benefits that we can derive from that, given the work of the Dundee Drugs Commission and the action plan that has emerged from that. You know, beyond that, the issues around funding, we need to work through what that's going to mean in practice and what opportunities that will provide, because we would obviously wish to be making sure that we can demonstrate that we've taken on board the opportunities that additional Scottish Government funding has brought to deliver particular responses in particular circumstances. So we will look forward to reporting on that in due course. I don't really have any great detail at the moment. Kenny may have some additional information there, but we need to necessarily escalate this up our agenda and be in a position where we can report in future to provide the assurance that the IJB would reasonably demand in relation to the response locally around substance misuse and particularly drug-related deaths. So apologies, I don't have any more details today, Chair, but if Kenny wants to come in at this point, I'm happy to bring him in, and as I say, we can provide further information moving forward.
Okay, thank you. Mr. Ogilvie?
I mean, certainly in relation to trying to determine the impact of substance use services, we do have an overarching performance framework which attempts to do that. Certainly historically there have been challenges given that different services between health, social care, third sector have used different systems and different measurements. An integrated system to provide consistency called DAISY was recently implemented. Unfortunately, it wasn't implemented in time to give full figures for the year in question, but going forward we should get better performance information out of the DAISY system for next year's report and future reports. So that system will hopefully improve, and that's linked to what's called the Recovery Outcome Web as well, just to try and get a better idea of both individual outcomes and systemic outcomes dependent on service delivery. In relation to the rehab beds, yes, funding was provided late last financial year, ring-fenced for rehab beds. We have got that funding in ring-fenced in a budget, and we're just implementing processes just to ensure that funding is allocated in the best manner possible. Like I say, what we're probably going to go down is the route of some sort of a panel which will meet basically as regularly as required, so people know how to get their applications in. Those applications will then be assessed, and with a minimum of bureaucracy and delay, rehab beds sourced and provided where they are deemed appropriate.
Okay, thank you for that, Mr. Ogilvie, and we'll look forward to a report on that to the IJB or the Audit and Performance Committee as soon as you can. Now, thank you, Councillor Duff, for your forbearance, and you had a couple of questions.
Thanks, Councillor Roberts. Yeah, I've listed them in the chat, but effectively my first one was on page 31. It talks about older people's mental health, and there's a reference in there to increased use of beds out with Perth and Kinross due to capacity and flow challenges. I was interested to know how big an issue this is, and whether it's been a long-term issue or something that has become relatively recent. And presumably with an ageing population, this could become an increasing issue unless we address it. That's my first question. Thank you.
Thank you. Chief
Yeah.
Officer.
Thank you, Chair. Thank you, Councillor Duff. Yes, that's an important point. I suppose it's so part of the challenge is that which we would have experienced even had we not a pandemic, and that, as you've described, is the growing numbers of older people, particularly people who are impacted on by dementia, affected by dementia, and who require long-term hospital care or long-term nursing care. That's been compounded by the difficulties that we've experienced with COVID, and that's because partly there's the general issue is around the lack of available nursing care beds in care homes that are suitable and equipped to deal with those behaviours that can challenge services, those exhibitions of stress and distress that some patients will sometimes give out, that means that we need really highly specialist services and supports in the community to maintain and manage and support those people. So what we're experiencing is both an increased demand, a lack of that resource, which absolutely is a commissioning challenge for us that we need to address, and we need to engage with the sector to seek to mitigate. But that's been compounded by the fact that throughout the pandemic, the opportunities to discharge people from hospital to care homes have been greatly impacted by care homes being affected by COVID and being closed to new admissions, and being, operating with reduced occupancy as a result of that, including because of the impact the pandemic's had on staffing levels. More generally, we are discussing with colleagues in Angus and Dundee and within NHS Tayside whether the psychiatry of old age services should be looking to operate on a more pan-Tayside basis, and whether or not we can benefit from developing an approach that utilises the available capacity more proactively in a more planned way, including in an assessment of whether we've got the right beds in the right place with the right staff with the right skills. So there are some discussions taking place in that regard. Our ability to progress them will be somewhat limited by the service manager responsible going off to work in a different job, but we'll need to look at how we can address that. But the other consideration is around looking at the extent to which admissions to those beds are appropriate, and whether or not if they are inappropriate, that is for the want of what type of resource. What can we be doing to support people at home for longer to prevent those admissions? What can we be doing to be developing community services, including with the care home sector, that enables people to not have to be in hospital for any length of time? So it is the case that at the moment we have pressures on our psychiatry of old age wards in Murray Royal in terms of demand pressures. Now, as would be the case with any such provision, at times we will have people from Perth and Kinross who might be in a Dundee hospital bed, and at times people from Dundee might be in a Perth and Kinross hospital bed, and there is a management of capacity relative to demand that does take place either within Perth and within individual areas where we do seek to consume our own smoke, but obviously at times there's a need for overspill and a need for us to help each other out, and that's essentially what we're seeing at the moment, is that there are small numbers of people who might find themselves in Dundee whilst there is no bed in Perth and Kinross, and at any other time vice versa might apply.
Okay, thank you for that. My second question was just fairly straightforward. On page 34, it talks about the appointment of a senior suicide prevention coordinator early in 2021-22. Has that post been filled?
I wonder if Andrew McManus has got an update in that regard. I've not heard whether or not we filled the post yet. I know it was being advertised probably a month ago, so hopefully we're making some progress there, Councillor Duff. But certainly, to provide assurance that the IJB, the Health and Social Care Partnership Executive Management Team, had felt it necessary to create this new post, to identify the resources, and we're doing so in collaboration with Perth and Kinross Council, so that the support that this person will provide will also reach into schools and be of benefit to younger people. But I see Angie is able to come in here, and maybe Kenny as well. Thanks, Andrew.
Thanks, Gordon. It's just to say I hadn't heard any update as yet, but I do know the recruitment authorisation processes have gone forward, but we can certainly find out for colleagues on the call.
Thank you.
Thank you. It might be that Kenny's got an update.
Yes, we had hoped that we could use a previous job profile to advertise this post, but we heard back from our HR colleagues it's going to have to undergo a job re-evaluation before we can advertise. So we're just working with our HR colleagues to try and progress that as quickly as possible.
Okay, thank you.
Thank you, Councillor Duff. Okay, we have a few more further questions. One from Mr. McPherson.
Thank you, Chair. I've got a couple of linked questions really on the impact of COVID on the services that we offer in the community. Firstly, on page 30, there's a section around primary care services, and it would be helpful to hear just from Gordon and his team how they feel that the condition of primary care services is at the end of the current year. And how that's developed over the course of the year. You know, what lessons have we learned from the pandemic, and you know, what might we be doing differently in the future? And my second question was around public dental services, where again, you know, we know that has been impacted. So do we have a sense of the, you know, what is the backlog in public dental services, and what's the overall impact of that in public health, and what can we do to address the backlog that I'm sure must be there now?
Thank you. Chief Officer.
Okay, thank you, Chair, thank you, Donald. I am going to struggle with a response in relation to the current position with regard to the public dental services backlog, but Angie, in lieu of Evelyn Devine today, might have some information, or perhaps not. We might need to provide that offline, but obviously we would be assuring you that we're applying the revised Scottish Government guidance about the delivery of those services and responding in a way that addresses highest priority need and levers in remobilised services moving forward. In terms of primary care, I mean, I think the contribution of primary care from the outset of the pandemic has been remarkable. We have derived significant benefits from really effective working with our GP colleagues and through the commitment and compassion of district nurses providing services in local communities. It's probably the case that much of what we need to advance moving forward in relation to primary care is really articulated around the GMS contract already, and the provision that we need to make to ensure that GPs can operate as expert generalists, and that we move to a position where the Health and Social Care Partnership is bringing forward a range of services that takes some of the workload demand away from GP practices that need not be dealt with by GPs. What we've seen throughout the pandemic is the opportunity to accelerate some of that activity in relation to social prescribers, in relation to mental health support to GP practices, in relation to MSK services, and in relation to care and treatment services, which are all designed and all component parts either of the GMS contract or of the Action 15 funding that the Scottish Government gives us to increase the numbers of people working in and around mental health services. So what we've been able to do is accelerate some of that activity. What we saw was GPs working effectively in their own practices, in clusters, and then across the GP subcommittee and LMC on a pan-Tayside basis really effectively, and to our enormous benefit and to their enormous credit in responding to the pandemic. Early on, we saw the COVID assessment centres being set up, and patients being able to be pathwayed through a particular COVID pathway to avoid putting the additional pressure that might otherwise have presented to GP practices. We saw practices developing their own contingency measures, getting into daily reporting, working together to ensure that services, primary care services, were able to continue to be sustained. What we saw in the later wave, the second wave round about Christmas and into the new year, was the continued commitment of GPs, but the potential that was being impacted on by some of those staff themselves having to self-isolate and not being available to provide support. So again, we saw really effective work by our primary care lead, by our associate medical director, and by GP practices in looking at how to mitigate some of the impact of that. So there has been enormous goodwill, there has been enormous commitment, there has been creative working across organisational boundaries, there has been use of digital where appropriate, and there has been a real commitment to a collective endeavour that really needs to provide a very strong baseline foundation for us moving forward. As I say, in delivering on the GMS contract and taking us to a position where GPs are able to provide more time utilising their skills, because there are a range of services around them that people can be triaged to or signposted to. So I think we've got a really strong platform moving forward, Donald, and I think that's probably the case across Angus and Dundee. And at the same time, there is some longer term work being done linked to the workforce plan and linked to some work that we're doing around the premises strategy for GPs that will enable us to be sure that we're sighted on areas of risk moving forward, either in terms of the GP workforce population, including practice nurses and including the contribution that we make around district nursing, but also some of the premises issues that have been fairly tricky for us and continue to present challenges as we move forward. So I think we're in a really strong position, and the important thing is that we don't expect to go back to how things were. We capitalise on the benefits that we've derived through working through the most difficult of circumstances.
Thank you, Chief Officer. Okay, we now have a question from Bob Benson.
I have three areas I wish to cover, Chair. The first one is on page 37, which is about the rising demand on mental health and commissioning from the third sector. I think this area could be strengthened within the report in terms of not just about commissioning, but how we're helping those third sector bodies to capacity build so that they are in a position to be commissioned to deliver those services. I'm not expecting an instant answer on this, but I think we can beef that up, because it's clear that with the rising demand of COVID and long COVID, we now have quite a major issue here. My second point is about public dental services and its impact. There are actually figures on the reductions of attendances to our public dental services, and indeed as a consequence to primary care services for reporting upwards in terms of key issues around early reporting to oral and maxillofacial, around early cancer treatment. And what now seems to be appearing is that patients are presenting much later with much more advanced cancers. So I think that area needs to be highlighted a bit more in terms of the drop in referrals from public dental services. This is a big issue. And finally, on page 47, assessment of the impact of delayed adult care packages. Basically, what future resources do we need given the delays to these? Thank you.
Okay, thank you. If we perhaps start with the Chief Officer, and Chief Officer, you can bring in anyone else that you feel might be helpful to answer those 3 points.
Yes, thanks, Chair. Thanks, Bob. So I think you're right that we maybe have undersold what we've done in relation to supporting community mental health provision during the pandemic, because of the additional support that we have given to probably now 7 or 8 or 9 third sector organisations, and that is really around how they can remobilise their services during the pandemic, but beyond, in terms of thinking about sustainable models. And that's recognising that some of the people who they were supporting anyway would need a different type of support during the pandemic. But it also recognises that some of the people that they had not previously encountered would need support with regard to their mental health and emotional health and well-being because of the pandemic. And that there are also some areas across Perth and Kinross where it has otherwise proven quite difficult to provide services that we've been able to through the pandemic, because of the virtual offering that enables us to reach into far-flung reaches of the region. So there's probably more that we could be saying there. Part of the challenge that officers, colleagues within the Health and Social Care Partnership will reflect back to me is the balance between keeping their support short and focused and readable, and putting everything in it that we've been doing over the past year, and we have gone through a bit of a process in that regard. I was looking for it to be reasonably concise, but your comments very reasonable. Again, in terms of public dental services, I think the information that you've provided is helpful. Part of the challenge around public dental services is it isn't just a case of reinstating those services as they were before on an incremental basis as the restrictions relax. There are particular situations or particular considerations that need to be made that require us to commission minor works in order to ensure there's adequate ventilation to offset the risks of aerosol generating procedures. So we haven't been able to just get back into addressing that backlog as quickly as we would have liked, because we've got a very clear understanding of the need to make sure that we're adhering to revised infection prevention and control guidance and are creating a safe and effective work environment. So we've been relying on NHS estates to provide support or to commission that from elsewhere in order that we can ensure that public dental services are able to operate as effectively as possible. Beyond that, sorry, your final point, Bob, was around adult care packages. You're on mute, sorry.
Sorry, Chair, it was the assessment of the impact of delayed adult care and what future resources do we need? Okay, so we're in the position where, as we've reported to the IJB and probably to the Audit and Performance Committee, the level of demand that we experienced last year was less than we might have anticipated. A consequence of that is that we ended the year with an underspend, which we've been able to carry forward. Now, what our expectation is, and probably what our experience increasingly is, that we are now experiencing a heightened demand, an increased demand, and that includes from people who have a higher level of dependency or acuity. So we have the capacity, we have the resource, and we have a very strong commitment to ensuring that we are very clearly articulating a message that we are open for business and that we want people to come forward, particularly to come forward before their situation reaches crisis point, and that we will find ways of providing services and supports that enable people to be supported in their own home for as long as possible, safely and effectively. So whilst this report reflects the position that we were in last year, I am aware that I'm now starting to describe what we're doing here in July and August and in this year. But that should provide some assurance, hopefully, that we are seeking to extend the range of service offers that are available, and we are using the additional resource and the underspends that we were able to carry forward from last year to ensure that we've got sufficient capacity to respond and provide
the care and support that's necessary to respond to service user need. I see Jane's got some additional comment that I'm very grateful for her to contribute. So over to you, Jane. Thank you.
Thank you, Gordon. Yes, I just wanted to follow up very briefly on Gordon's comments. We have got our first financial forecast of the year now confirmed, and within that I can confirm there's been a huge swing in our complex care packages from that underspend last year to a significant increase in expenditure, which is most welcome and an indication that the backlog has now been significantly addressed in ensuring that the correct care packages are in place and with forecast expenditure now against them. So hopefully that just provides an additional reassurance that that is real and is coming through very early on in this financial year.
Thank you, Chief Financial Officer. Okay, now we don't seem to have any more questions on the report. So if we move on to considering the recommendations, as you will see in section 1 of the report, we're asked to approve the annual performance report for 2020-2021 and note the progress towards achievement of the aims outlined within the strategic commissioning plan for 2020 to 2025. So I'll invite people to indicate in the chat if they would like to make a comment on those recommendations or more broadly on the contents of the report. I'll just start by making a few observations. First, obviously, I'd like to thank officers for bringing together this report. I know it's been much more challenging than it would have been usually, given all of the other things that have been going on at the same time. Clearly, this has been a challenging time for the whole health and social care partnership, having to deal with the effects of the pandemic. And I'm sure I can speak for all members of the committee in thanking those staff in the health and social care partnership, our third sector partners, and also carers for all of their efforts over the course of the year that is covered by this report. Another point just to highlight, which I have asked officers to consider for future years, is how we better link the performance indicators and the narrative in the annual performance report to the strategic plan and monitoring our performance and progress with the strategic plan. Because I think we as an integration joint board obviously have the responsibility of setting the strategic direction for the integration joint board, and the primary way that we do that is through the strategic plan. And I think in future, while we've made significant progress in improving the performance reporting, we do need to ensure that that links back to that strategic plan and those strategic directions and aims that we have set out. So just to make you aware, that's something that I've asked for in future, appreciating that this year it has been difficult to pull the report together in the first place. So first we've got Bob Benson, who wants to comment, and anyone else if you could indicate, and I'll come to you in due course. Thank you.
Thanks, Chair. I concur with everything you just said. And what I wanted just to say here was that I think the conversation has been really helpful for that dialogue with the Chief Officer and the staff. And I think some of that may help to actually improve the actual report itself. And I think there were some areas where there were areas that were absent that they wanted to fill in later on. And I wondered if, in the light of all of that, that we can approve the report at this stage. And instead, I would suggest that we defer until the September IJB meeting where we could formally sign it off.
I'll take comments from others first, and then we'll come back to that specific point, because I think that there might be an issue with that, and that might be the reason why we have the meeting in August rather than in September, but we can return to that point. So can I just check if any other members want to make comments first? No? Okay, I don't know if the Chief Officer or the Chief Financial Officer could give some indication on the timescales. I see the Chief Financial Officer is wanting to comment.
if Gordon doesn't mind me coming in with a proposition, I have noted during the discussion this morning a number of the areas where further information has been agreed should be provided. I was going to quickly run through those, and if members were in agreement that those were minor amendments to enhance the report, that we should make those and agree that perhaps the chair sign those off, and that would allow us to publish the report in line with deadlines. We do have an extended deadline. The pandemic has given all of Scotland an extended deadline. However, I'm not sure that the material nature of the amendments proposed would require that. Would it be helpful, Chair, if I just run through the amendments that I've noted?
Yeah, I think that would be helpful, and then we can give it further consideration. Thank you.
Okay, I've noted that Councillor Duff has asked that we include in the table the historic Scotland position that would aid comparison around the Scotland-wide position, and it would be very simple for us to include that. Donald McPherson has asked us to include the explanation of NI20, and we've absolutely recognised that that is an error, and we can certainly circulate that explanation to all members as well as put that in the report. Bob has asked us to review the words that we've included around the strategic planning group to make sure that we are not taking credit for work done in the new financial year in the previous financial year, and we can look at that and make sure that that's appropriate. Bob has also asked us to consider whether we can say anything about the pilot that's emerging on health inequalities and whether it would be appropriate to include anything to enhance our report for last year in relation to health inequalities. Bob has also asked us to enhance what we've included around third sector support around mental health. We may also be able to, working with Morag, to include something around some of the issues that we're facing around the public dental service and make sure that that's clear. All of these are fairly straightforward for us to include and enhance, and I would ask members to consider whether it would be required to bring the report back or whether we can do it through sign-off by the chair before issue.
Okay, thank you, Chief Financial Officer, for that. I'll bring Mr. Benson in a moment, but I think I would be happy to agree to that approach, although perhaps it could be circulated to all members of the committee, just indicating when it would be signed off by rather than just me, because I'm conscious that we need to include everyone in that process. But I think that the points made are easily fixed and nothing major, although, as we've said, there are a number of broader changes we might like to make in future years to the way the annual performance report is put together. Mr. Benson, are you happy with that approach?
Chair, I'm happy with that approach. Thank you.
Okay, thank you for that. Okay, well, if there are no further comments, then can I ask the committee if, in line with that further suggestion from the Chief Financial Officer and the assurance that those changes will be circulated to all members to make you aware of those, are we happy to approve the annual performance report and note the progress towards achieving the aims outlined in the Strategic Commissioning Plan?
I'm happy to agree, Councillor Purvis, subject to your comments there. Thank you.
Okay.
Yes, likewise, happy to agree.
Thank you. And Mr. Benson, you said you were...
I'm happy to agree as well, Chair. Thank you.
I don't know if Bernie Campbell is still there. Are you happy? Are you content with that?
Yes, that's fine. Thank you.
That's fine. So all of the voting members of the committee are content. So with that, I think we have finished this item and we can conclude the meeting. The next meeting of the Audit and Performance Committee is on Monday, the 13th of September, and I'll look forward to seeing you there. Thank you.